everybody. We're here with CBS Chief Medical Correspondent, Dr. Jon LaPook. Now let's talk about misconceptions about testing negative and not being infectious. Because I was outside of the tri-state area when I was doing my show for those 5 months. And when I came back to do this, we had to sequester for 2 weeks. You know, we basically stayed in the house, cleaned a lot of cabinets. You don't believe how organized my sock drawer is right now. But we tested negative immediately when we came back, but it didn't matter. The rules in the tri-state area are, even if you test negative, you have to quarantine for 2 weeks. Why is that important?
Good rule. So if your viewers hear nothing else in this discussion than this, I would be satisfied, because this is the #1 misconception by far. There's not a close second in the entire pandemic from my patients in internal medicine and from other people who are speaking to me. You have to understand that the incubation period is 2 to 14 days. That means if I get infected today, I may not be infectious. I may not be able to be shedding virus or contaminate other people, infect other people for anywhere from 2 to 14 days. That means I'm infected today, it's in me, but not yet shedding virus and able to infect other people. I could test negative 5 days from now, say, and then think, oh, I can visit my grandma the next day. No, because 6 days after I get infected, I could become infectious. The 7 days, 8 days, 9 days, up till 14 days. So I have so many people say, I just flew in from Los Angeles. I think, who knows if I was infected or not. I'm gonna get tested today and see my grandmother tomorrow or somebody else tomorrow. No, you have to assume you were infected. And if you really wanna be careful, you gotta wait those 14 days.
Now, are there any treatments out there you are hopeful about?
I am, since last time you mentioned Remdesivir, that since has been shown to be effective in shortening hospital stay. And who knows, in a different setting, it may actually show an effect lowering mortality. We don't know that for sure. Dexamethasone has been shown to lower mortality in people who are intubated. And needing, that kind of severe intensive care unit support. That's great. And then we have these trials of convalescent plasma. So you asked about it last time. You said, if somebody gets infected, we know there are a lot of trials right now, and the jury's not in yet on those. You get infected, you have a lot of antibodies that you build up in your system. You take some of those and you give them to a patient at various stages, maybe who was exposed, who was disease.
I believe the example was, can we just go take Tom Hanks's blood?
Exactly. And the answer is no, because that's passive. Yeah, I know. Not that we wouldn't want Tom Hanks's blood. I mean, who wouldn't? What a nice guy. Maybe we would all become nicer.
I don't know.
What they're doing is the vaccine actually challenges your immune system it makes it think that it's been infected, so it mounts its own immune response. And then you're ready to go. You could be immune. If I'm giving you antibodies, it's called passive immunity. And while the antibodies are there, I may get some protection. But once the antibodies are gone in a month or two, that protection goes away. What's really interesting is something called monoclonal antibodies. And there are a couple of trials. I am excited about that. It's a technological tour de force. So when you get a regular immune response and you have the antibodies in this convalescent plasma, there are all sorts of antibodies. There's antibodies against the toe infection that I got last, some bacteria from that. And also there's antibodies against coronavirus, but it's any part of the coronavirus. It may be against a part of the coronavirus that's not very effective. There are antibodies that are right to the spike part of the coronavirus. It's called coronavirus because it's like a crown. That spike is the protein that allows the virus to attach itself to a human cell and enter it and attack it. So if you have an antibody that's neutralizing, it covers that spike, then you've neutralized the virus. Well, what these monoclonal antibodies do is, in the laboratory, and I won't bore you with how they do it, they make antibodies just to that spike. Not the ones to the toe infection bacteria, not the ones to the part of the coronavirus that don't matter. And they're doing trials now to see if that helps, various stages.
Like putting a cork on a dart or something like that.
Yeah, you could throw that dart, you could be hit by it, but not gonna be able to stick into you.
Well, Doctor, thanks so much for being here again. I hope the next time we talk, it's to discuss the new vaccine that everybody's getting. Dr. Jonathan LaPook, everybody. We'll be right back with Maroon 5.